Menuju sukses ditentukan oleh langkahmu hari ini dengan terus memilih yang terbaik. Berdiri sejak 1985, mengabdi lebih dari 30 tahun. Berbagai prestasi nasional dan internasional. Melangkah menuju masa depan suksesmu bersama IIK Octaviata. Pendidikan berkualitas, tentukan masa depan cemerlang. Dibimbing dosen berkompeten. Mahasiswa dicetak terampil, andal, dan profesional. Penerapan kurikulum KKNI dengan 60% praktek dan 40% teori. Mengasah keterampilan mahasiswa untuk bersaing dalam dunia kerja. Dilengkapi 63 laboratorium sebagai sarana memaksimalkan pembelajaran. Katalog online perpustakaan untuk mempermudah pencarian literatur. Atmosfer akademik yang baik. Telah luluskan lebih dari 14.000 alumni sebagai tenaga kesehatan profesional. Dibimbing oleh dosen berprestasi hingga taraf internasional. mengasah potensi mahasiswa untuk menjadi unggul dan terbaik. Fasilitas sarana olahraga untuk kegiatan mahasiswa yang aktif dan sehat. Metode pembelajaran audiovisual di auditorium. Menuju sukses ditentukan oleh langkahmu hari ini dengan terus memilih yang terbaik. Berdiri sejak 1985, mengabdi lebih dari 30 tahun. Berbagai prestasi nasional dan internasional. Melangkah menuju masa depan suksesmu bersama IIK Octaviata. Pendidikan berkualitas, tentukan masa depan cemerlang. Dibimbing dosen berkompeten. Mahasiswa dicetak terampil, andal, dan profesional. Penerapan kurikulum KKNI. dengan 60% praktek dan 40% teori. Mengasah keterampilan mahasiswa untuk bersaing dalam dunia kerja. Dilengkapi 63 laboratorium sebagai sarana memaksimalkan pembelajaran. Katalog online perpustakaan untuk mempermudah pencarian literatur. Atmosfer akademik yang baik, mendukung proses belajar mahasiswa. Pendidikan didukung oleh sistem komputerisasi. Berpengalaman lebih dari 30 tahun. Mencetak tenaga kesehatan profesional. Telah luluskan lebih dari 14.000 alumni sebagai tenaga kesehatan profesional. Dibimbing oleh dosen berprestasi hingga taraf internasional. Asah potensi mahasiswa untuk menjadi unggul dan terbaik. Fasilitas sarana olahraga untuk kegiatan mahasiswa yang aktif dan sehat. Metode pembelajaran audiovisual di auditorium. menuju sukses ditentukan oleh langkahmu hari ini dengan terus memilih yang terbaik. Berdiri sejak 1985, mengabdi lebih dari 30 tahun. Berbagai prestasi nasional dan internasional. Melangkah menuju masa depan suksesmu bersama IIK Octaviata. Pendidikan berkualitas, tentukan masa depan cemerlang. Dibimbing dosen berkompeten. Mahasiswa dicetak terampil, andal, dan profesional. Penerapan kurikulum KKNI dengan 60% praktek dan 40% teori. Mengasah keterampilan mahasiswa untuk
to apologize for keeping us waiting due to technical problems. Excellencies, ladies and gentlemen, we will start our conference opening program shortly. Please be seated. Ladies and gentlemen, distinguished participants, before we proceed this event, I would like to announce you some important information. During Q&A or question and answer session, if participants have questions, please write them via the link provided by the committee. Participants must fill in the attendance list that will be given 15 minutes before this event ends. For those who successfully completed the form, including inserted the screenshot of YouTube live streaming, will get e-certificate and the materials presented in this conference. Participants are required to take part in this event until it is completely and orderly. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
His Excellency, Rector of IIK Octaviata, Professor Dr. Muhammad Zainuddin, His Excellency, Secretary of the Institute, Mr. Anang Setiawiono, Her Excellency, the Dean of Faculty of Technology and Health Management, IIK Octaviata, Mrs. Triana Mulyati, Her Excellency, Head of Public Health Study Program, IIK Octaviata, and one of our speakers today, Mrs. Endah Ratnani, Respected speakers, Professor Dr. Rusli bin Nordin from Mahsa University, Malaysia, Professor Mikhail Bloganrovov from RUDN University, Russia, distinguished guests and participants, ladies and gentlemen. A very good morning to one and all. As Indonesian says, Selamat pagi. We wish everyone in a good health today. My name is Yeni Nurmala, and I feel honored to serve as the Master of Ceremony today to welcome you and express our sincere gratitude and appreciation to your participation on the second International Conference of Public Health organized by Bachelor of Public Health Study Program, Faculty of Technology and Health Management, IIK Bhaktiviata Kediri, under the theme, Public Health Intervention in Suppressing Health Problems during the COVID-19 Pandemic. Today, December 16, 2021. Thank you very much for joining us at the Zoom meeting and also YouTube live streaming. Excellencies, distinguished participants, ladies and gentlemen, preceded our agenda this morning, may we present you the Indonesia National Anthem, Indonesia Raya. We would like to request all of you to be in a perfect posture. And please kindly listen to the hymn of IIK Bhaktiviata afterwards. Excellencies, distinguished participants, ladies and gentlemen, coming up next is the welcoming remarks by Rector of IIK Bhaktiviata. We would like to invite Professor Dr. Muhammad Zainuddin to deliver the welcome remarks and officially open this conference on behalf of IIK Bhaktiviata. His Excellency, time is yours.
Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. It is a great pleasure for me to welcome you to the second International Conference of Public Health 4.1 about public health intervention and suppressing health problems during COVID-19 pandemic. I am very thankful to all participants, especially for all speakers. Professor Rosli bin Nurdin from Mahsa University, Malaysia. Professor Michael from RUND University, Russia. And Indah Rutnani from IIK Bhaktiviata for taking time out of your busy schedule to attend this event. I also wish thanks to the committee who have organized this wonderful event. I am especially honored to welcome to all participants in this international conference. My name, Muhammad Zainuddin, the Rector of Bhaktiviata Health Science Institute, IIK Bhaktiviata. On behalf of the people Bhaktiviata, I would like to say that it's our privilege and pleasure to have this great event held in our institute. I can already to see the big potential from the participant. I hope that through this event, we all can learn to be a good and critical thinker in public health intervention and suppressing health problems during the COVID-19 pandemic. I wouldn't like to take too much to your time, so I will hand it over to our MC, Mrs. Yeni Normala, to proceed the next agenda. Once again, welcome and thank you very much for attending this event. I wish all participants good luck and thank you very much for your attention. Assalamualaikum warahmatullahi wabarakatuh. Thank you.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Prof. Zainuddin. With all due respect, due regard for something considered important on another occasion, His Excellency Prof. Zainuddin could not take part in this event until it is completed orderly. But
Thank you
Prof.
very
Zain,
much.
please stay with us. Because continuing our agenda, we are going to take pictures to memorize this precious occasion. May we request our guests of honors and all participants to take position, and our team will manage and start taking your pictures in turn. We have 2 screens here, and kindly please follow my lead. Start from first screen. Screen 2. Thank you. Thank you very much, Prof. Zainuddin, for delivering the remarks and on officially opening this conference. Thank you, Prof. Excellencies, distinguished guests, participants, ladies and gentlemen, before proceeding our agenda, in order to run this agenda well, please be silent and bow our heads for a moment and say a prayer. Those on duty, Mr. Wildan Akasha, is welcome.
Assalamualaikum warahmatullahi wabarakatuh. A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Hamdan syakirin, hamdan na'imin. Hamdan yuafi ni'ama wa yukafi'u mazidah. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhikal karim wa adhimi sultan. Asyhadu an la ilaha illallah wa asyhadu anna Muhammadar Rasulullah. Allahumma sholli wa sallim ala sayyidina Muhammadin wa ala alihi wa sahbihi ajma'in. Ya Maliku, Ya Qudus, we glorify your name because you alone are our Lord. To you alone we prostrate. To you alone we give thanks. And to you alone we pray. Ya Rahman, Ya Rahim, we worship and ask for help from you only. Ya Rabbana, our Lord, all praise be to you, the preserver of the universe. All praise for the gifts and pleasures that you bestow on us. All praise be to your majesty. All praise to your glory and power. This morning we are praying for your generosity. Today we gathered here for Second International Conference of Public Health, IPHS 40.1. discussing how to make the best contribution to the nation. Oh Allah, launch our event, bless you. Fill this meeting with kindness from the beginning to the end. Refill our hearts and minds, flex our tongues, so that we can receive useful knowledge given by our teacher. Give us bright ideas to build the strength of this nation. Oh Allah, who knows the unseen, guide us with your guidance. Bless us always with your destiny, and make our hearts always happy with your gifts. Rabbi shrahli sadri wa yassirli amri wahlul 'uqdatam min lisani yafqahu qawli. Allahumma arinal haqqa haqqa warzuqna ittiba'ah wa arinal batila batila warzuqna ijtinabah. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Wa sallallahu ala Muhammadin wa ala alihi wa sahbihi ajma'in. Subhana rabbika rabbil izzati amma yasifun wa salamun ala mursalin walhamdulillahi rabbil alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. Excellencies, distinguished guests, participants, ladies and gentlemen, without further ado, we are going to proceed our agenda by presenting the three speakers facilitated by our moderator. Before that, allow me to introduce our moderator today. She is Miss Ati Ulinuha. She was born in Kediri, East Java, on October 30, 1992. She lives in Semen, Kediri, East Java, and we can contact her via email at ati.ulinuha@iika.ac.id or via phone number 085-746-407-515. She obtained her master degree majoring in English language teaching from Universitas Negeri Malang in 2016. And currently, she is an English lecturer at IIK Bhaktiviata, a translator in www.translatejournal.com and translating, and a member of Himpunan Penerjemah Indonesia. Her latest research project is Breaking the Wall Using More in Teaching English for Gen Z, an evaluation in dentistry students. May we invite Mrs. Ati to serve us the upcoming session? Miss Ati, time is yours.
Thank you, Miss Yeni. Distinguished guests, ladies and gentlemen, good morning. Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, the presentation is about to begin. I am Ati Ulinuha, and I will be serving as your moderator today. First of all, I would like to welcome you all to this conference. Today's conference is about public health intervention in suppressing health problems during the COVID-19 pandemic. In this special occasion, we would like to have 3 presentations. Before the presentation begins, let me inform how the presentation will be going on. First, each speaker will be invited to present the material and followed by question and answer session. You can deliver your question through the link provided by our committee on the comment section or the chat box. Now, I would like to introduce the first presenter. He is Professor Dr. Rusli bin Nurdin, Professor of Public Health Medicine from Mahsa University, Malaysia. You can reach him through his email as presented on the slide. He obtained several degrees, membership, and fellowship from several prestigious universities across the countries, such as Monash, Malaya, Tokyo, Ireland, Malaysia, UK, and Australia. He has had several key administrative positions within academia. Currently, he was appointed as the Dean, Faculty of Medicine, Bioscience and Nursing of Mahsa University on June 1, 2021. Professor Rusli has experiences as an editorial board of several medical and health sciences journals, and accordingly, he is very active in writing. And now, please welcome Professor Rusli to present his presentation on strengthening the accessibility of health services with telemedicine. Professor Rusli, the time is yours.
Thank you very much, Ms. Atik, and our MC, Ms. Yeni Normala. Please, my apology if I say it wrongly. You know, I'm not very good in using Indonesian language, but thank you anyway to the organizing committee for inviting me to present the first paper on the telemedicine. And I think what I can do now, I'll just try to I'll share my paper and I'll continue. Right? And I understand the time is very short for me as well. So can you, Ms. Atik, can you allow to enable my paper to be shared?
Sure. Wait.
Yeah. I seem not to be able to share my paper here. Okay. All right. Can you all see my paper?
Yes, we can, sir.
Yeah. Okay. So very important. Otherwise, difficult to present. Okay. So, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. And a very good morning. Selamat pagi to all my distinguished speakers, Professor Michael Blagon Rabov, and also Ibu Enda Retnani Wismaningsih, and also to all participants to this second International Conference on Public Health. And my sincere gratitude to His Excellency Professor Dr. Muhammad Zainuddin, Rector of Institute Ilmu Kesihatan Bakti Wiyata Kediri, and also to Ibu Enda for your kind invitation for me to participate as a speaker in the second International Conference of Public Health in the Institute of Ilmu Kesihatan Octaviata, Kediri, Jawa Timur, Indonesia. And this is done under the Indonesian Public Health Series 4.1 with the theme of public health intervention in suppressing health problems during the COVID-19 pandemic. So when I was first requested to present a topic on telemedicine with the title of Strengthening the Accessibility of Health Services with Telemedicine, I was under, my first impression was, in this time of COVID-19 pandemic, telemedicine is actually is a very potent weapon, very potent instrument and tool that we can use as public health specialists, practitioners, to address several health issues in the community. And this applies, I think, to all community in Indonesia, Malaysia, and elsewhere in the world, especially in the Asia Pacific region, because now under the COVID-19 pandemic, and hopefully we will go into endemic, right? We are still very much under constraint of social mixing, social environment, okay, and difficulty of accessing health services. So this topic given to me today, I think it's a very, very interesting topic and very important to me, because it drives home a very important message, and that at the end of the day, what really counts in terms of addressing community health is whether we could harness the power of the ICT, right? of the internet, of multimedia application. We can harness those power to serve the needs of the community in terms of tackling all the current health issues, not only COVID, right? But you must remember that during COVID-19, we also have many other diseases, non-communicable and communicable alike. So with the restrictive policy and SOP, including worldwide vaccination to contain the wave of COVID-19 infection, we have to rely more and more on information technology and multimedia application to suppress health problems during this difficult time. Please stop me if there's a problem with my presentation, right? And please inform me. So the content of my talk today is that the first one is I will give a very brief introduction to the scenario of the telemedicine. I take the liberty to introduce telemedicine, what our experience in Malaysia has been with telemedicine, especially in the flagship application that we have developed by the Malaysian government, and especially now with the COVID area, how we use them. So I divide my talk into the 4 areas. First is the looking at the best practice in Malaysia. Perhaps later on can be used in Indonesia as well and other places, right? Our Malaysia's future healthcare system. Secondly, I would like to look at the how do we harness the information age to build Malaysia's future healthcare system. Thirdly, is about telemedicine implementation strategy in Malaysia. And lastly, healthcare system transformation issues related to telemedicine. And the last is conclusion. So these are basically the areas that I'm going to go in. So the first thing just to share with you, telemedicine actually is not a new phenomena in I guess in the world, okay, because it has been there for quite some time in many parts of the world. The only thing is that it is something that many people are not aware, because either they are not aware, they are not actually trained to look at it in that way, or because the use of ICT, of multimedia and applications has been so rampant around the world, has been so dominant, that it is taken for granted. Okay, so people look at it as for granted. So many of the access that we have to telemedical facilities, consultation, information, and so on, has been largely taken for granted. So this is just to share with you one of the studies done in Malaysia not so long ago in 2018, this is looking at the usage of telemedicine in Malaysia. As you can see, all right, majority here, about more than 50%, yeah, haven't used but would try. Quite a big number. No, this is not very very old data. It's about 3 years ago. Okay, so you have even in Malaysia, you see, more than 50% of people haven't used telemedicine. That they love to try it if they have the opportunity. And the rest you see, for instance, like 19% haven't used and wouldn't try, 13% not sure. Okay? The only one that have used only about 10%. Okay, and 5% used but wouldn't use again. So there is some kind of reluctance in the way that when we invite people to look at telemedicine in that particular instance, seems to be an issue. I don't know about in Indonesia, no? Maybe we can do a study later on to compare data across Malaysia, Indonesia, maybe other countries in Asia Pacific, right? Even Japan, you know, Korea, China, and so on. See what are the pattern there. And then, so as I said earlier, I have taken the liberty to share in this presentation. Malaysia's Telemedicine Blueprint, which is leading healthcare into the information age under telemedicine flagship application. So the Malaysian government has started this project way back in 1997. Many years ago, they started this project because in anticipation of the transformation of our environment, right? We are moving along from the agricultural age. We go to the industrial age. Now we come to information age, right? There's another age later on. We call it the conceptual age. Then I will come back to that later. So because realizing that we have to move along this continuum of a different era of activity for population, government of Malaysia has taken the first step to introduce telemedicine as a blueprint, as something that the country as a whole will look into as a strategy by Malaysia, no? To ensure that we completely use this technology, right, in the service of our population. So this is a very important thing. And then secondly, of course, with these changes in what we consider as the industrial revolution, right? We come from agriculture, we come to industrial revolution. Now we have industrial revolution 5, right? Moving from 4 to 5. Again, and now, especially now, is during this very trying time of COVID-19. And as you know, COVID-19 has not left us. 2 years we are the COVID now. All right, started in 2020. Now we are 2021, almost finishing. Now we are going into the next phase of COVID with the Omicron variant now lurking somewhere. No, if I can see many cases now, even in Malaysia at the moment, our hospital are quickly being filled by patients with Omicron, I think. And so it is something that we cannot say we will go off. No? The pandemic may even go to, some people predict even 5 years. No? It will go on unless we take some very, very strong measures to contain the virus. So this is again the development of this telemedicine blueprint. Got it, the flagship application Malaysia started way back in 1997. And as you can see in this diagram here, we have a vision of our telemedicine. There's a goal there, services that we'll provide, application, tools, and technology that we are going to use, the networks we're going to use. They are basically, these are all internet and so on. Organization, processes, people, finance, you know, and especially now at the bottom of this almost like a rocket is the policy, laws, regulation, technology, standards. And this is, of course, the whole thing is also helmed by this agency that has been developed in Malaysia called the Multimedia Super Corridor. Okay, this is agency developed to especially now to look into this application of telemedicine. Just a short digression to say what is it about telemedicine that is so important. I just want to share with you this the idea of this 4 ages of nation, right? Because every country, I think, or every nation in the world has gone through this. Yeah, the 4 ages, 4 ages, which is agriculture, industrial, information, and now called conceptual, according to Dr. Darren Berg, okay, colleague, which is now many people wouldn't know about this. Yeah, it's a new term called the conceptual age. Right? So we have in the 18th century we have the agricultural age, right, where farmers rule and owners of fertile land were prosperous. In the 19th century we have the industrial age, where factory work boomed and owners of factories made fortunes. In the 20th century we have the information age. Not so long ago we are in this, and even now we are saying we are still in the information age. All these ages are overlapping actually, where knowledge workers reign supreme. Billions were made by founders of IT companies, many much younger than their forebears. And then now, right, with the COVID coming so great to us, it's also coinciding with the new age of the 21st century, especially in the next decade, right? What we consider as the conceptual age, the age of creators. So more and more creators of things, that just like you call it Internet of Things, creators of application, they become the so-called now the supreme commander in the world that we are. And then the 5 industrial revolutions. Okay, the 5 industrial revolution, as you can see here. All right. So we have the first industrial revolution, which is basically more mechanization. Second industrial revolution, electrification. The third one, automation and globalization. The fourth, digitalization, and the fifth, personalization. Okay. It can be very interesting. Again, these are all overlapping. So now we are now in the 5th industrial revolution. As you can see, these changes across the nation, across the world. Okay. And this 5th industrial revolution is in the 2nd decade of the 21st century. You can see here we have innovation, purpose, inclusivity, deep multi-level cooperation between people and machine consciousness. Okay. You can see that how much we have traversed the gulf, the different ideas, the different capability, starting from the mechanization of the 1st industrial revolution right up to the 5th industrial revolution, spanning all this what we call this development of electrification, automation, globalization, and then we all talking about digitization, and now we got personalization. Okay, it's more about a higher order of skill. Okay, so coming back to the so understanding where the position of all nations, and in this case, in this context, I'm trying to posit the position of the Malaysian healthcare system, future healthcare system. We have actually in Malaysia developed what we call as a Malaysia Vision 2020. Now it's already 2021, right? We have in fact have already surpassed 2020. But interestingly, you see when the forefathers of Malaysia developed this they call it the wawasan. This is as it says here, by the year 2020, Malaysia is to be a united nation with a confident Malaysian society infused by strong moral and ethical values, living in a society that is democratic, liberal and tolerant, caring, economically just and equitable, progressive and prosperous, and in full possession of an economy that is competitive, dynamic, robust and resilient. Very, very powerful words, but we need to also look how much we have achieved in this 2020. Okay, and Of course, in the context of this vision of 2020, we also have these so-called challenges. And when you talk about telemedicine, the challenges are basically in healthcare. You know, telemedicine, because the word tele means is about communication, and medicine is communicating medicine using IT and so on. So what are the challenges? You can see here, right? Now we have changing demography and disease pattern. We have now totally different demographic distribution of our population and totally different disease pattern, right? Let alone we have COVID, we also have many non-communicable disease. In Malaysia now, unfortunately, many of these NCD, they call it, those of you who are doing public health, right? School public health, you know, very, very dangerous development in the so-called the new epidemic of the NCD, diabetes, hypertension, hypercholesterolemia, and so on, right? Okay, or this due to the changing lifestyle, sedentary lifestyle, and what call this poor dietary habit, okay, and so on. And then, and of course, lack of exercise. And then, of course, you have the other one issue is that there is this uneven resource distribution between, in most cases, it would be the difference between the rural and urban areas. Okay? You find that so much of this IT are concentrating in the urban areas, less in the rural. So this very marked disparity, they call it, between these two. Okay. Thirdly, you find that there is increased consumer expectation. Now consumers are more dominant and aggressive in what they expect from the nation, right? And that applies to even healthcare. And then we have also issue about outdated health infrastructure. Certain infrastructure, health infrastructure, remain as we call it as being, you know, in the old time, right? For some reason they don't move forward. Maybe because of due to financial issue, or maybe lack of support and so on, they remain as such. Okay, and then we have inadequate service integration. Right, services are all actually disconnected from one another. There is no unity in it. Right, or sometimes we call it the word inclusivity. Right, it's difficult for when you have non-united what call this services. You have difficulty trying to harmonize, work across this type of services. And then we have shortage of funding, as usual. In any of government deliberation, funding, money very important. The funding, source of funding to support all this that want to do, especially now in telemedicine, that requires a very big undertaking, and which means that a lot of investment has to be done to develop the required infrastructure, because the hardware of it, the software is something else, but the hardware itself is very important, that need to be harnessed, need to develop, and this way the government must be committed to do this. And later on we see whether there is this you know, the collaboration between public and private entity to carry out this telemedicine. And of course, the last but not least are the new medical technologies that come in. As you can see now, even today, you can see even in the university, all these are happening. So then we have issue about, you know, about disease per se. Here we take, for example, we have diseases like you know, cardiovascular disease, you know, cancer, and so on. And we can see that pattern, changing pattern. Accidents, right? We have motor vehicle accidents, industrial accidents, you just name it. Commuting accidents, those people going to work and going back, having accidents. So number of discharges per year for cardiovascular, cardio and cerebrovascular disease, accident, cancer, and some of these so-called classic diseases like diphtheria, polio, and pertussis, whooping cough, right? Bordetella pertussis, whooping cough. In Malay, we call batuk pokok in Malaysia. So you can see that there is this changing pattern again across time from 1985, 1990, 1995, which is about less more than 20 years ago. But today we must see what are now the demographic. What is the trend now? Because this trend will influence the development of the telemedicine. And then of course other issues like deaths in the government hospital. Okay, what are the changing pattern? Now we see, for instance, more and more of this. This is 1995, right? Cardio cerebrovascular cause of death. Okay, cardio-cerebrovascular accident. Okay, so cardio and cerebrovascular 26%. Okay, it's a quarter of all deaths in the Malaysian hospital. 1995. Now in the year 21, we still have this as number one, and then we have accidents still, perinatal condition 10%, and then cancer. Cancer coming up, by the way, become very rapidly now. Okay, very fast. Cancer is catching up because of the modern lifestyle. Now what else we see in our healthcare system? Malaysia is to be a nation of healthy individuals, families, and communities. So what are the things we look for? On the left hand side, we see the characteristics of future healthcare system. What are our goals? It has to be equitable in the sense that everybody should be able to access healthcare. It should be affordable, right? Affordable. It should be efficient, technologically appropriate, okay, environmentally adaptable, consumer friendly. All these things actually, even today we have the goals which are defined by WHO, right? Sustainable Development Goal, okay, SDG. Okay? These again all has been included in those, but these are, I said, noble ideas about what it takes to provide healthcare, comprehensive healthcare, equitably across the nation, and that will apply to all countries, including Indonesia and so on. Right? And then emphasis of future healthcare system. All right, what emphasis? Quality. We look for quality. We want our healthcare to be first class quality. It must be innovative, right? It has an element of novelty in it. It has element of health promotion, not just prevention in terms of, or even just of treatment, but we must also promote health. Okay, we must promote health, and then respect for human dignity. Very important, right? So this is where the issue about the access of health for all. Promotion of individual responsibility. We have to be responsible, and then promotion of community participation. Okay. These are some of the vision that has been laid down by the forefathers of this the upcoming telemedicine. And of course, what are the goals of future healthcare services? Here we have, for instance, we have on this left hand side, we have wellness focus, we have person focus, right? Self-help, care provided at home or close to home, seamless, continuous care, services tailored as much as possible, effective, efficient, affordable services. All very laudable and clearly very good idea, okay, of what it takes to have a good and efficient future healthcare in Malaysia. Okay, and on the right side you can see these are the description how to achieve all these noble ideals of the health services. And then of course, as I mentioned earlier, when I make reference to the 4 ages of nation, right? Now you see this move from the industrial age medicine, right, to the information age of healthcare, and later on we are moving to the conceptual age now. Okay, this is more of the next what we call this age of nations, conceptual. So here you can see the first one, industrial age. You can see that is a pyramid, right? Pyramid. At the top we have the person, community, primary, secondary, tertiary, the care. Yeah? These are now transformed, and this pyramid has been now inverted And you can see now, individual self-care become very dominant at the top. Okay, people are now much more responsible for their health. And then we have friends and families, community networks, and then all these professional as facilitators, professional as partners, professional as authorities. Right? So more and more we see, as I said earlier, the notion of telemedicine, where people become more responsible for their health. So that mindset has to develop in community if we are to see any big progress in the footprint in the development of the telemedicine program in nation. And here again, another issue is that the program under telemedicine in Malaysia, one of the biggest ones called the Lifetime Health Plan. Okay? In Lifetime Health Plan, it's a comprehensive idea about health, beginning from when you're born. Okay, we call it from womb to tomb. Okay, womb to tomb, from the time you're born. Here, for instance, we see here information, education, consultation, right? Wellness, illness, when you're well, when you're sick, right? Right from antenatal care, postnatal care, childhood, adolescent, adult, geriatrics. It's the whole spectrum of the person is taken into account. Okay, so the telemedicine actually is developed to be this comprehensive, right? Wholesome, comprehensive, takes into account the whole spectrum of the individual lifespan, and to look at specific areas of focus to be able to improve. And right across this, we have the element of consultation, which is part of what telemedicine is all about. Information giving, education, all right, and so on. So this is an example of development of the telemedicine. Now the other one is that the second component that I mentioned under content is that how to harness the information age to build Malaysia's future healthcare system. Harnessing, yeah, all right. So here we have telemedicine, as you know, referring to the provision of healthcare and related services across a multimedia network linking consumers, healthcare providers, suppliers, consumers, and other agencies. Okay, this is what telemedicine. So you can see on the left-hand side here we have healthcare providers, right? All these clinics, primary healthcare centers, doctors, pharmacies, laboratories, imaging center, X-ray and so on, imaging, MRI, just a CT scan, you call it hospital. These are the healthcare providers. And then we also have the center of teaching, like what we are doing now, like in your own institute, and also in like MASA, for instance. We are universities where we do research, we are teaching students, and as a student who are learning about healthcare. All right. And then we also have this healthcare financing, the money that we need to be able to make this all possible, right? And this includes even insurance companies. Now healthcare insurance become a major issue now in all countries, even in Malaysia. Healthcare financing, okay? How to finance healthcare, right? So that will be another discussion, maybe not here, but perhaps another forum to discuss about healthcare financing in many countries now in Asia Pacific. And then we have so-called managed care organization. This again another very very strong development. I think until now many these are organization that actually take over the running of all this health institution to make it more efficient. So this is called managed care organization. And then we have the public institution like government, Ministry of Health, Ministry of Work, Labor, and so on. Ministry of Education. These are all these public institutions. And then we have the healthcare consumer, which is basically you and me, right? The patient, relative, community, those of us who consume, who actually are using these services. And then we have the healthcare suppliers, those who provide the services, right? These are the medical equipment that you see in the clinics, hospital, the pharmaceutical material that are provided, the pharmacists, right? Okay, the pharmacists who are right in the and smack with supplying medication and so on, laboratories doing investigation, and imaging centers. And all these, as you can see, all these sectors are linked by the so-called multimedia network nationwide and global. Can you see? This is the idea of telemedicine. That it is a system that gives some sort of connectivity across these many facets of the healthcare system. Okay, from the healthcare providers, the universities teaching, public institution, healthcare consumers, healthcare suppliers, healthcare financing. Okay, all actually will have access to this. This is why now I mentioned about the age, moving from the now to the information age, from industrial to information, and later on we go to the so-called conceptual. Again, this one I already mentioned. Okay, telemedicine role in achieving health service goals. What are these? In Malaysia, according to our telemedicine flagship application, they have wellness focus, person focus, informed person, self-help, care provided at home or close to home, seamless continuous care, services tailored as much as possible, and effective, efficient, and affordable services. So we have 1, 2, 3, 4, 5, 6, 7, 8. What we call this role that we envisage for telemedicine. Okay, and on the right side is what are the role here in terms of the actual thing to do. For instance, like wellness focus, right? How do we achieve it using telemedicine? Is to promote wellness throughout life through network-based services and health management tool. Just like I showed in the previous slide. Okay, the multimedia, ICT, and so on. Provide user-friendly virtual services when and where required. Provide accurate, timely information and promote knowledge. Increase the ability of individual to manage health through knowledge transfer and interactive network-based health management tool. Provide distributed multimedia network. Integrate personal health and medical information across episodes. Customize and integrate services and provide enhance access and so on. So as you can see, these are all the element of telemedicine, which is based principally on this strength of the ICT and also multimedia and application. So look at it again. What are some of these development that we envisage in Malaysia? Telemedicine links people and delivers services. Individuals and professionals use network-based or network-linked applications, tools, and technologies to help them manage health and access a comprehensive range of services. The focus on people and services with technology playing the key enabling role. Okay, so the technology becomes the enabler of all these services. So here you have the provider, here you have consumer. Okay, here you have the healthcare services here, information, education, consultation, support, governance, right? And these are the application, right? Multimedia application, tools, technologies, and these are the network that all of you are so familiar now. Okay, internet and so on. Okay, right. So and then of course here again you look, is in a different way we put it here again, looking again at this connectivity here. Lifetime health plan provides the individual with a powerful tool to access health services and manage their health throughout life. You can see, right, from the left to the right. This is the lifetime health plan. Okay, where you can access information, education, all at fingertips, consultation, and you can do it for wellness, issue of wellness, for immunization. Right now, especially in COVID time, you need more and more about immunization, COVID vaccine, right? Immunization, and then medical checkup. You know, we have regular checkup, episodic illness, chronic illness. More and more we have the problem with chronic illness like diabetes, hypertension, cholesterol, you know, all this ischemic heart disease, stroke, cancer, you name it. These are all chronic disease, chronic illness that we have to address. So this is where I think the beauty about telemedicine is that all these are at the fingertips. You can access them. And how do we now, the third part of it is that how do we implement this telemedicine? As you can see, in Malaysia, it started in the year 1997, right? We move on. Now we already have exceeded year 2020. We're now 2021. Also finishing. We go to 2022, right? But this actually is how it goes. It just get expanded further into the year ahead. From pilot study, pilot expansion, of new pilots, national implementation. So by the year 2020, we already implemented. Many of these actually have already been implemented, right? And the custodian is primarily the Ministry of Health in Malaysia, MOH, yeah, Ministry of Health. And we have the change strategies and enabling framework. So as you can see, that this is a the element of implementation is what we consider as transformation, right? It's progressive across time, from here to here, progressive across time. Okay, so across a span of about 20 years, and these are the enablers that you can see. Yeah? And basically we consider this as a transformative change. Transformative change meaning a radical change in the makeup of this program as we move across time. So at the end of the year, by 2020, we already have in place telemedicine as a program in the delivered one on the one hand by government, which is a public program, on the other hand also by the private sector, which are also providing these services to the public. So telemedicine projects will be implemented according to a clear roadmap, whereby initial and successive pilot projects are identified, implemented, and rolled out nationally. Okay, so it's a planned program of telemedicine in Malaysia. And again, I think I've shown this earlier. The same thing, right? We have on both sides, right? The providers, the consumers. We have all these services they provide. Right? Those who access information, education, consultation, support, governance. Okay, these are the multimedia application, multimedia network. And then, what are the high impact pilot projects? There are 4 under the Malaysian telemedicine project. There are 4 pilot projects which are being driven driven by the government. Okay, one is called the Mass Customized Personalized Health Information and Education. Okay, this is for the community, right? For the nation. Customized, personalized health information and education. But now more and more, I think people are thinking about personalized medicine. Those of you who do medicine will understand that this personalized medicine become a very important development now in the world. And then we also have what is considered as a continuing medical education. Okay, and then teleconsultation. Very interesting, this teleconsultation, right? In various ways. Okay? You can access practitioners from hospital to provide consultation. You don't have to travel to the hospital, save time, save cost, and so on. Okay? And then lifetime health plan that I showed earlier. And here we see the function of the first one, the function of mass customized personalized health information education program include health information content creation, okay, packaging, delivery, and usage monitoring. Okay, you can see here. So we are on this side, we have the beneficiary, which are person, community. Okay. Then you have target, the delivery, you have the ministry that actually monitor this program, and then the source. So you can see it's one linkage. The target here you can see hospital, health clinic, general practice, home, and so on. Delivery are the network issues. Okay, and across the internet, telephone line, ISDN line, and so on. Okay, and then we also have the service provider. We have the content supplier, okay, which is monitored by Ministry of Health, and the source here. Okay, and we have the content database and delivery and monitoring. So it's in one go. We have this system of delivery, right, of implementation of the telemedicine flagship application in Asia. And then, of course, if you look at it closely now, the new development, they become segmented into various areas. For instance, now the teleconsultation application, when you consult, links clinics to hospital through the provision of appropriate end user equipment. For instance, you can see here, this health center, hospital, right? And this is the healthcare provider. This is our patient, right? This again healthcare provider, and we have this multimedia network. And when you consult, then become segmented to this. You can have telediagnosis, consulting to find out what is the diagnosis of your condition, tele-ECG, tele-echocardiography, tele-screening, tele-pathology, tele-radiology, tele-stethoscope. All these tele, yeah. These are not unknown now. It's not anymore a new thing, right? It is very common now in all countries. Okay. And then we have also this lifetime health plan I mentioned earlier. Okay, here again, you can see how it's being developed, right? Okay, we have this lifetime health plan here, the whole thing that I mentioned earlier. Personalized lifetime health plan, this is personalized for individual. Lifetime health record, where we store information online, even cloud-based and so on. Okay, data mining. So this again bring into focus for all researchers to be able to do data mining. For a lot of this health record need to be analyzed, need to be analyzed, need to be reported, need to be shared. Okay, and then this is where statistical analysis and so on. Okay, and this health info management and support services. Okay, so on. Okay, and on here we have this clerical support system, CSS. So you can see very clearly, how actually this plan is developed. And then we have the entire scope of telemedicine pilot project. So this is in a way a summary, right? Summary of the telemedicine in Malaysia. Okay, we have the I mentioned earlier, the information education CME. We have the lifetime health plan. We have the teleconsultation. Okay, and all this digital network of how they are connected. The interconnectedness of all this system. And of course, in the strategy, we need to have also custodian. For instance, like here, we have the multimedia super corridor, which is a very big agency developed by government to actually look at this development, and they are responsible for looking at the opportunity to advance, to improve on existing capability of advanced telecommunication infrastructure, test bed for leading edge technology. And here we have non-multimedia super corridor site. Okay, these are more for greater needs, evaluation of effectiveness of pilot project between pre and post telemedicine to represent a site of Malaysia. Okay, so they are to work together. And this application, these are the enablers. Okay, so you have watchdog. We have an agency that look into this. And then of course we have also this implementation approach dimension of expansion. What are they planning? What more they can do with the functionality and the reach of each application, number of programs. So there is expansion in all this. Okay, functionality of each application, number of program, discipline, reach of each application, user geography. So the program of telemedicine is not static. What it really means that as we move along this continuum of time, telemedicine become much more advanced. Right? I use the word just now was transformative. Transformation. We transform telemedicine over time. And these are the program that has been taken as pilot program in Malaysia because of this number of deaths in hospital. So develop pilot program into cardiovascular health, injury prevention and management, got a lot of accident, antenatal, perinatal management, and then for cancer prevention management. So all this become our pilot program. And these have again shown tremendous success in terms of generating lots of data for analysis, even for students doing studies, PhD, masters, and so on, can access all this database, right, for the study. And last but not least are standards. In any of these telemedicine, as you know, we need standards. So these are some of the standards of telemedicine: vocabulary, store type data, transmission, security services, common infrastructure, and all these are clearly shown in this diagram. And what are the major challenges in implementing telemedicine? These are the challenges. Okay, the challenges are basically number one, healthcare organization. We have to look carefully here. The clinics, hospitals, and so on. Process re-engineering. Are we willing to re-engineer the process? In other words, we may have to abandon certain process that are maybe already outdated, right? In view of the changing landscape of technology and so on. We have to change people. Very important. Very important and very difficult is to change people. Okay? We have to look at the healthcare financing. Can we have a new type of financing? Okay, healthcare, the enablers. Laws and regulation need to be reviewed, revised, and updated. So So telemedicine, as you know, if you look at it, is very much, as I said, transformative, evolving project in not only in Malaysia, as I gather, also in Indonesia, in many other countries. But this is just me sharing some of the initiatives that have been done by government Malaysia in terms of telemedicine. Okay, so to address the major challenges in transforming the healthcare system, a comprehensive change management approach will need to be supported by an enabling framework of policies. Enabling framework. The framework must include policies, law, regulation, and standard. Okay. And finally, the conclusion is that these are the things. Right? What do we are looking for in the telemedicine? So the first one, of course, we say telemedicine products and services provider. Number one, we need to develop that, the products and the service provider. Secondly, we must have international showcase in healthcare delivery. We cannot just be, happy with our own local development. You need to be at the global level, international level. Thirdly, we have global telemedicine link. You can run away on this, right? As much as we have development of country, we have many more development across the globe, especially in more advanced economy, right? So we need to link with them on telemedicine. And lastly is the center of telemedicine, very important, R&D and new business development. Okay, R&D for research, continuously doing research to improve. So I guess that's all I can say about my own experience and that in Malaysia. So I would like to thank all of you for your patience through this. Hopefully not too long for me. And I will try to answer any question that you may have. So back to MC and moderator. Thank you very much, everyone. And I hope that we can, share this discussion. Thank you very much.
Yes, thank you very much, Professor Rusli, for the interesting and insightful presentation. So we can see that telemedicine is very well planned and regulated there in Malaysia. So now we already have several questions. The operator will present the question. Here is the question, sir. The first question is from Tias. In Indonesia, there are some telemedicine, but they are not used maximally yet, especially in some region or some population that cannot access it. How about in Malaysia? Can you explain me what the strategy?
Yes, thank you very much. So the strategy here, basically, as in any strategy, of new ideas, new application. The first is very much of education. I think we need to support this in a way, because it started as a government Malaysia government initiative. So we need to support the initiative. So that I think the telemedicine concept, application, and so on need to be widely distributed in the community. In other words, in the schools, it must start from schools. It goes to the university, like what we are doing today, right? We have do discussion is one example. We need to market it, like marketing. We need to market it because if you don't market something, and as I mentioned earlier in my talk, that the most difficult to change people. Most difficult, right? You can change process, you can change system, you can revise law, you can do this, but most difficult to change people. So I think and people can only be changed through number one, of course, is education, right? So we need to educate all level of society first about telemedicine. We need to have easily identified telemedicine projects that can be shown to be easy to use, easy to access, cheap and friendly, and adaptable and so on. These are very important, right? There's no point of having telemedicine programs, very expensive, difficult to access, only available, say, only in certain selected center. You cannot. So these are important. So I stress again. One is we must educate the population at all level, right from grassroots to those studying, students like yourself or myself, educators in the university, in schools, in colleges, and so on. Secondly, is marketing. Need to be broadly marketed by all parties, not only government. I think there must be this collaboration between private and public, right? Both government and the private sector must also be interested to see it as a national agenda. It is not only for business, but it is a national agenda of the nation. Yeah, that's very important. Then thirdly, we must have, as I said, the facilities of telemedicine must be able to be shown to be easily accessed, cheap, all right, and accessible. So these are the elements. If you can do this in the community, I think soon you will find telemedicine become something very easy to use. That's my thinking, lah. Yeah. All right.
Okay, thank you, sir. So the top two most important is education and marketing, where the collaboration between government and private to build the national agenda. Now move on to the second question. The second question, please.
What's the question? Sorry.
From Anjani, how to record, perhaps, if using telemedicine in Malaysia, and how long the health standards to store data in Malaysia.
Yeah.
Oh, this is related to the medical record.
Yeah, this medical record, is a very critical. In Malaysia, we call it registry. Many of these applications, we record them, we store them. It becomes an official activity of registry. I give example. We have the National Cardiovascular Disease Registry. In other words, all disease related to cardiovascular is stored here. Is captured online. It is stored. It is analyzed. In fact, I myself have published papers with my PhD student. This is what I said at the end. Many of these databases become useful for those of you who wanted to do your postgraduate, like what you want to do masters, you want to do PhD, even not only that, even the undergraduate, you are going to write a paper on your project, final year project, and so on. These are databases you can easily access, and using appropriate software like SPSS or R language, you can analyze it and then come up with sensible data about this. So it become useful tool or database that you can do. Now they talk about people have talked about big data analytics. People come in a very big way, to look at data, all this data, and trying to do, we call it data mining. We mine the data. We try to produce useful information from the data. And that can be easily translated into PhD candidate, master candidate, and then for conference, for publication, you name it. And then at the end of the day, there is a engagement of the scientists. We can share the information. So this, I think, this is why the medical record. You must remember, if you go to hospital now, last time it used to be stored manually in it. Now all electronic. Am I right? If you go to any hospital now, slowly it is going to be changed from manual kind of difficult now to find. A major hospital now have bulky folder in the hospital. Even in Malaysia, many hospital they go paperless. Right? All data now are captured electronically and then shared. Immediately you obtain, you share into your database. Okay, and this, I think, the way to go. So we become digitized, we become paperless, right? And the data can be mined, can be analyzed, and then you can produce many reports, and those can be used for the nation, right? To improve the healthcare system in the country. So this I think This way, I think the usefulness of medical record. And this medical record actually, because they are nowadays very much digitized, you call it e-record, right? So the moment you go to any clinic, hospital, you just need to bring only your identification card only. They ask you in Malaysia they call IC, identification card. Right? Just give a number. When they click the computer, all the data is there. All right. You don't have to go anymore. You don't have to wait for ages, you know. And in fact, sometime now, you may be able to access all your data yourself, because you are given the right to see your data, isn't it? So data now become a fingertip. You can even access it on your smartphone. Can you imagine? Because of this technology now, right? Everything now is on the go. Smartphone technology, you know, enable you. I'm very sure most of those participants, the younger one, they're so familiar, right? Nothing is difficult now. Just by click on the phone, you get it. So that's the kind of data, I guess, will be in the next age of the conceptual age, where people are begin to see data on the go, right? Data where you can access cloud-based storage, retrieval. Now we have cloud, okay? So gone are the days where you have to rely on, you know, on manual, on what call this, file folders and so on. That's gone. Now it's all seamless. It's all electronic, digitized, cloud-based, you know, computing, and and it can be accessed at anywhere, anytime, right? This is what we're doing now in our university. Yeah.
It's very well organized. Okay, thank you, sir. So now we still have another question. Perhaps this is the last question. The question is from Eva. How can we strengthen public trust so that they can consult health via telemedicine, whereas as known public assumption of touch treatment is direct healthcare is more confidence.
Yeah. You know, technology. One of the things we realized, technology, you know, may be good in doing this thing, but there is certain thing. Maybe technology has limitation that need to be overcome. Example, doctor-patient relationship. Because when we are trained in medical school, for instance, especially doctors and so on, this is a very critical part of the consultation is the doctor-patient relationship. Hubungan antara doktor dan pesakit, ya, amat penting. You just imagine, if you can see your doctor only through teleconsultation, hanya secara maya, secara virtual, you bayangkan, adakah di mana akan apakah akan berlaku? What will happen? So you will not be, you may develop a lot of things, maybe less trusting the doctor. We don't know the person face to face. This one now during the pandemic, bila kita dalam pandemic, then only we realize the beauty of face to face contact. Isn't it? You miss your friend, correct or not? Even now, you miss your friend, you miss your kawan. Mungkin yang ada girlfriend boyfriend miss juga, ya, pacar pun miss sebab dia tidak berjumpa face to face, only virtual. You just imagine, that's what happened in the community. What more if in the context of the doctor and patient, doktor dan pesakit. Jadi there's one issue about when you raise issue about trust, it's very true actually. But that I think is something that over time, I guess.
Well, it seems that we lost the professor. Okay, it seems that we lost the presenter. So in short, from the 3 questions, I can conclude that from the last question, especially how to gain the trust from the patients, it is very important, especially in this pandemic era. Everyone, of course, miss the direct contacts from one to another. And then the education, of course, this is related to the second question, yeah, actually. Oh yeah, currently we also have Ibu Ana, our beloved Dean. Hello, Mrs. Triana Mulyati.
Hello.
Perhaps you can greet your our participant here. So actually, after this presentation, it's supposed to be the certificate awarding for Mr. Professor Rusli from Ibu Triana Mulyati, but it seems that we still cannot reach him currently.
Okay. I think Mr. Prof. Rusli is not here, but on behalf of Faculty of Technology and Health Management, IIK Bhaktiwiyata, and it's great honor to have Prof. Rusli here, and we gain valuable insight of your interesting topic. And hopefully, after the pandemic, we can meet Prof. Rusli in a person. Thank you.
Mrs. Anna here, we already have Professor Rusli.
Yeah, sorry.
Professor.
Yeah, sorry. I think something goes wrong. Yeah, suddenly
Yeah.
the thing went off. But it's this all. This is also a problem with telemedicine. This we call it the internet glitches.
Yes, sir.
Yeah.
Here
So
is our
anyway, those are I think the main point about about the last question about trust of people into this relationship, because of is very much a virtual relation. Yeah. But I think that over time, I think can be overcome. If we can get used to this system of virtual relation. Yeah.
Yeah. Thank you for the very clear explanation, Professor Rusli. Now, here is our Dean, Ibu Mrs. Triana Mulyati, MSE. She will present the certificate to you, sir.
Oh, thank you very much. Thank you.
Ibu
Terima
Triana
kasih.
Mulyati, the time
Terima
is
kasih
yours.
banyak-banyak.
Thank you, sir, for the participant in our international conference here. Hopefully, after the
Terima kasih. Thank you for the certificate.
Yeah, it seems that we have Ibu Triana have internet internet
don't worry.
problem as well.
It's a common thing, no? Internet, yeah.
I'm so sorry for that.
It's okay.
I'm so sorry, sir.
It's okay. It happened to me also. Don't worry.
Okay.
Yeah,
Thank
it's very
you.
very common, very normal. Yeah, don't worry.
Yes.
Okay, again, thank you. So now let's move on to the second presentation. Our second speaker today is Mrs. Endah Ratnani Wismaningsih, SKM MKes from IIK Bhaktiwiyata Kediri. She obtained her bachelor degree in public health from Universitas Jember in 2009. and obtained her master degree in public health as well from Universitas Erlangga in 2014. She has been active in writing and researching, as well as conducting community services. Here is her CV. Currently, she is a member of AIPTKMI Regional Tengah 2, IAKMI, and Persakmi. You can reach her through her email, endah.wismaningsih@iik.ac.id. She will present her presentation on vaccines for specific protection. Mrs. Endah, the time is yours.
Thank you, Bersati. Good morning, Prof. Lusli. Thank you for your presentation. It's very insightful for us. Okay. On this opportunity, I will share to you about vaccine for specific protection or vaccine as specific protection. Okay. Before I share about vaccine, as public health practitioner, especially, we have first to understand about the context of health. Okay. According to WHO, World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So, from this concept, we can understand that health is a holistic state, not only physical, but also mental and social well-being, including economic. But unfortunately, most people only define health physically and merely the absence of disease or infirmity or disability. Health itself is a fundamental human right. So it must be attained holistically by all people in the community. But to attain health is not only dependent on the government, but also depends on individual and the community. Then to attain health holistically, we must understand first about prerequisites of health. It needs to be fulfilled. That is based on Untitled Chapter. There are 9 prerequisites of health that are peace, shelter, food, education, income, a stable ecosystem, sustainable resources, social justice, and equity. From this, we can see the link between prerequisite of health and concept of health itself. For example, if this attain, for example, that is when we live in a community with no conflict, then we can say that we attain health physically and mentally because we feel at ease, we have nothing to worry, we have nothing to worry about our safety, and where there is no conflict, we have a stable income, sustainable resources, so we can pursue optimum well-being, including an opportunity to have highest education, level, then we can pursue a better job, so we can have a higher income to meet our needs, including health fund. As a public practitioner, we realized that our main role was in prevention domain. And according to Dictionary of Epidemiology, prevention action aim at eradicating, eliminating, or minimizing the impact of disease and disability. The concept of prevention itself is best defined in the context of levels that's we've known as primary prevention, secondary prevention, and also tertiary prevention. Prevention as action needs to be implemented with a different strategy depending on the goals and the target. There are two strategies that are population or mass strategy and high-risk strategy. The strategy was directed to prevent disease occurrence. According to WHO, disease prevention described as a measure to reduce the occurrence of risk factor, prevent the occurrence of disease, and to arrest its progress and reduce its consequences once established. So from this concept, we've known that prevention not only prevent the occurrence of disease, but also their risk factors. There is saying in Indonesia, lebih baik mencegah daripada mengobati. That it's better to prevent than we have to have treatment to heal our health problems. Then further, Level and Clark divided prevention into 5 levels of application of preventive measures that are health promotion, specific protection, early diagnosis and prompt treatment, disability limitation, and rehabilitation. The first level, health promotion, and the second level, specific protection, are primary prevention. Then early diagnosis and prompt treatment. The third level was secondary prevention, and the fourth and fifth, disability limitation and rehabilitation, are tertiary prevention. As public health practitioner, we have understand that our responsibility were in this primary prevention. The concept of primary prevention is an action taken prior to the onset of disease, which removes the possibility that this disease will ever occur. The primary prevention directed towards lowering the prevalence of risk factor common to a range of diseases such as tobacco and alcohol use, obesity, and high blood pressure in order to prevent the initial occurrence of disorder. We've known that tobacco, alcohol use, obesity, and high blood pressure is a risk factor for many diseases, for many health problems. For example, we can we can minimize those risks by through behavior change advice. It may also include action that inhibit environmental and economic and social conditions known to increase this risk. So it is not only intervention to change negative behavior, but also to change the environment in order to support health. Then the first level is health promotion, defined by WHO as the process of enabling people to increase control over and to improve their health. In this concept, we must enabling people to maintain their health status and then improve it as maximum as possible, starting from making them realize what is their health problem, including what the risk factor for their health problems and how they can overcome or cope with it. So if they're getting sick, they've known what they have to do, so they can heal, thus they can maintain and improve their health in order to attain health status holistically. That is physical, mental, and social well-being. According to Level and Clark, health promotion include health education, good standard of nutrition adjusted to developmental phases of life, attention to personality development, provision of adequate housing, recreation, and agreeable working condition, marriage counseling, genetic screening, periodic selective examination. Then we continue to specific protection. in this level 2, specific protection, including use of specific immunization, attention to personal hygiene, use of environmental sanitation, protection against occupational hazard, protection from accidents, use of specific nutrients, protection from carcinogens, and avoidance of allergens. Vaccination is part of specific protection, that specifically immunization. The definition of vaccination, according to CDC, is the act of introducing a vaccine into the body to produce protection from specific disease. Then the preparation that is used to stimulate our body respond against disease, we call it vaccine. As the result of this stimulation, from the vaccination, from getting vaccine, that is, a person who's getting vaccination can have antibody against an antigen. If we talk about COVID-19, then our body will have antibody that will against SARS-CoV virus. Then, what kind of vaccine that we can get safely and have effectiveness? WHO has recommended several COVID-19 vaccines that are BioNTech Comirnaty, developed by Pfizer-BioNTech Manufacturing, then Covishield, developed by Serum Institute of India, PVT Ltd, AZD1222, developed by AstraZeneca, AD26.CoV2.S, developed by Janssen, pharmaceutical company of Johnson & Johnson, mRNA 1273, developed by Moderna Biotech, SARS-CoV-2 vaccine, developed by Sinopharm, or Beijing Institute of Biological Products Ltd, then CoronaVac, developed by Sinovac Life Science.co Ltd, and the newest one was the Covaxin, developed by Bharat Biotech Covaxin. Those recommendation given by WHO after long procedure measurement called EUL procedure, emergency use listing procedure, that is assessed, that is based at risk based on procedure for assessing and listing the unlicensed vaccine, therapeutic, and in vitro diagnostic. And we also can check the list of other companies wishing to submit their products described in AUL procedure in the link provided by WHO. So we can know that when we learn about another vaccine, we can check is it have finished their AUL procedure or not. But don't worry, this recommendation is if you have vaccinated by this vaccine recommended by WHO, it means that this vaccine is safe for us. We've been struggling with this COVID-19 pandemic for 2 years globally. For the first occurrence after Wuhan, it only 3 months later in Indonesia, we have reported the first confirmed case. Then right now, only in weeks, there have been new variant confirmed case in Indonesia, in Bekasi, about a week ago. So vaccination is one of the tools one of strategy to suppressing the onset of COVID-19. There are benefits of COVID-19 vaccine explained by Health Ministry of Indonesia that are stimulating immune system toward COVID-19, reducing the risk spreading of COVID-19, then also reducing the risk of serious short and long-term complication from COVID-19, and also obtain herd immunity. to fight COVID-19 pandemics, our governments have so many regulations, so many policies as their responsibility to increase or to prevent the spreading of COVID-19. This regulation have a role as their legal foundation to suppress COVID-19, especially regulation about and related to vaccination. There are several examples of the regulation, only several. The first was Keputusan Presiden Republik Indonesia nomor 18 tahun 2020 tentang Tim Nasional Percepatan Pengembangan Vaksin Coronavirus Disease 2019 COVID-19. This regulation regulate about COVID-19 development vaccine by a special force appointed by President, our President. And the second one was Peraturan Presiden Republik Indonesia nomor 50 tahun 2021 tentang perubahan kedua atas Peraturan Presiden nomor 99 tahun 2020 tentang pengadaan vaksin dan pelaksanaan vaksinasi dalam rangka penanggulangan pandemi coronavirus disease 2019 COVID-19. This regulation regulate about vaccination starting from procurement of the vaccine and also the implementation. And then Peraturan Menteri Kesehatan Republik Indonesia nomor 19 tahun 2021 tentang perubahan kedua atas Peraturan Menteri Kesehatan nomor 10 tahun 2021 tentang pelaksanaan vaksinasi dalam rangka penanggulangan pandemi coronavirus disease 2019 COVID-19. This regulation regulate about technical instruction. This regulation regulate about vaccination implementation in Indonesia. The fourth example is Keputusan Menteri Kesehatan Republik Indonesia nomor HK.01.07-Menkes-4638-2021 tentang petunjuk teknis pelaksanaan vaksinasi dalam rangka penanggulangan pandemi coronavirus disease 2019 COVID-19. This regulation regulate about technical instruction of vaccination implementation in Indonesia. And the next example is Peraturan Menteri Keuangan Republik Indonesia nomor 188/PMK.04/2020 tentang pemberian fasilitas kepabeanan dan atau cukai serta perpajakan atas impor pengadaan vaksin dalam rangka penanganan pandemi coronavirus disease 2019 atau COVID-19. This regulation regulate about imported vaccine and therefore. Then the last example is Instruksi Menteri Dalam Negeri nomor 57 tahun 2021 tentang pemberlakuan pembatasan kegiatan masyarakat level 3, level 2, dan level 1 coronavirus disease 2019 di wilayah Jawa dan Bali. This regulation regulate about restriction on community activities in Java and Bali. In this regulation, for example, the government has been enacting vaccine certificate as travel requirements. In this Instruksi Menteri Dalam Negeri nomor 57 tahun 2021. And in another regulation is enacting about vaccination type that is called vaksinasi program and vaksinasi gotong royong. Vaksinasi program held by government, while vaksinasi gotong royong can be held by non-government organization and or individual and or another organization. Based on the regulation, so many regulations, it proves that government have been encouraging the acceleration of vaccination coverage. But unfortunately, based on the data per December 15, 2021, vaccination achievement is still far from the target. This is the target, and this is we can see the number of first dosage vaccination, second dosage vaccination, and third dosage vaccination. For now, based on our government policy, the third dosage is given to health workers because they are the most highest risk group of COVID-19. This data is based Satuan Tugas Penanganan COVID-19 or National Task Force of COVID-19, Indonesian National Task Force. Okay, then how about COVID-19 effectiveness? There is a study by Ministry of Health on health workers on January until June 2021 in DKI Jakarta. The study observed the health workers who get vaccinated. From the study, it is resulted that the health workers who get vaccinated still can be infected by COVID-19, but vaccination itself proved to protect health workers from risk care and death by COVID-19. We've known that vaccination, when we get vaccination, it doesn't mean that we have 100% protection. It doesn't mean that we will never get infected by COVID-19, but it means that we have more protection towards COVID-19. So as more as people get vaccinated, it is expected that fewer people will come into contact with the virus. It means that fewer people will be getting sick because COVID-19, or suffer severely because COVID-19, or death because COVID-19. From the study, we can see that health workers who have been vaccinated completely have a lower death, that is 0.01% during the period of January to March until March 2021, and 0.001% during the period of April until June 2021. From this vaccine, we also learned that effectiveness of complete dose of CoronaVac in preventing infection COVID-19 was 84% in January and March 2021. This is the data of health workers who are being treated for COVID-19. On those who didn't get the vaccine, there were increasing cases from 12.5% to 24%. But on those who get vaccinated first dosage, there is decreasing in case from 19.3% to 8.1%. And on those who got the complete dosage, the case also decreasing from 18% to 3.3%. This is also another data about health worker who died of COVID-19. From this data, we can see that there were increasing death on those who didn't get vaccine, on those who get first dosage, and decreasing death on those who get complete dosage. Okay, so the vaccine can protect us from spreading disease, can protect us from short or long-term complication of COVID-19 because our immune system has been stimulated. Therefore, in our community, also can attain herd immunity toward COVID-19. But we still have to practice health protocols diligently because we are not invulnerable. We are not never getting COVID-19 if we get vaccination, but it means that we have more protection by getting vaccination. So we must complement with other protection, that is health protocols, by diligently putting on masks, washing our hands with soap, ventilating our homes and workplace, practicing social distancing, staying at home and restricting mobility, avoiding crowds, and so practice health ethic. And these health protocols must be our new habit as a result of changing of behavior during the COVID-19 pandemic. Health protocols is our new habit. Thank you very much for your attention. Terima kasih.
Thank you very much, Ibu Indah. So it is a very informative and insightful presentation from Mrs. Indah. All right, ladies and gentlemen, currently we already have a lot of questions, but we will select several only to be answered by Mrs. Indah. Now we come to the question and answer session. The first question will be presented on the slide. The question. Okay. The first question is from Sari. How long do vaccines work in the body? And the second question is from Fauzi. We know that COVID-19 virus is easily transmitted. To anticipate a large problem in the future, we need a program. The success of the program requires support from the community and also the government. What's more, especially the new variants are starting to appear very easily contagious. Restriction on foreign tourists will be the cause as carriers. What we should be done in this prevention. So the first question is about how long the vaccine work in the body, and the second question is how to prevent to be infected COVID-19. That's it, the question, Ibu Indah. You may directly answer.
Thank you, Ms. Ati. For the first question is how long the vaccine will be work in our body, right? For different vaccine, there are different protection timing based on so many studies. Perhaps we can browse so many journals have their result on effectiveness or how long vaccine will be work effectively in our body. Based on WHO, for all for many vaccines, for all those vaccines, people will have built maximum immunity for maybe in a few weeks after getting vaccinated. It is based on WHO. But remember, even though we're getting vaccinated, it does not mean that we have 100% protection during those maximum immunity, those weeks of maximum immunity. So it's different for different vaccine, but generally it has few weeks after getting vaccinated, Ms. Ati. And for the second question, what to do next? That's right, Ms. Ati?
Yes, how to prevent.
How to prevent. Actually, we can learn from our 2 years experience during this pandemic. We have to start from ourselves. Government has included community to actively take action to eradicate, to eliminate, and to minimizing spreading of COVID-19. So what we can do next is to practice health protocols, getting vaccine, and encourage another person, our loved one, our family, our friends, and our co-workers to stay alert. To keep practicing health protocols and as our habits. As we know that the new variant has confirmed in Indonesia last week in Bekasi. Thank you, Ms. Ati.
Yes, now move on to the next question. We still have question for Mrs. Enda. Two more question. How long do has been answered, right? So from the Joseph, how public health can influence government focus on tackling the pandemic? That is his question, Ibu Enda.
Okay, thank you. Public health that have responsibility and prevention. Besides vaccine, our government have policy about health protocols. That is one of primary prevention, right? And there's health promotion. And if we talk about 5 level of prevention, actually during this COVID-19 pandemic, all those levels were clearly implemented, starting from the health promotion strategy. So many health promotion strategy, including community action. In Indonesia itself, our government has been including community to actively monitoring those who confirm positive in their neighborhood. Then in specific protection, we can see that there is vaccination and also health protocols, and for them who positively confirmed as COVID-19 cases, we also give prompt treatment as soon as possible. And for those whom positively confirmed, we also minimize the complication by giving them prompt treatment. And also we have a rehabilitation program for those whom has confirmed as negatively of COVID-19. For example, special task force in neighborhood, in village, they also actively contacted the person who's healed from COVID-19, whom confirmed as negative after they have confirmed negatively by PCR test. They still have contacted them. Maybe like Ati.
Okay, thank you, Mrs. Enda. But we still have time, so let's present another question. Perhaps this is the last question. From Riri, how the effectiveness of the program to society health improvement? Prevention can do other besides with a vaccine. The strategy to increase the scope of the vaccine.
Okay, actually I have explained I have shared in my PowerPoint before that beside vaccination, we have to practice health protocols. We still have to practice it. We still have to encourage our neighborhood, our family, our loved one, our friends, and our co-workers to actively practice health protocols and make it our new habit in our daily life. Okay. So the effectiveness also I have shared it in my presentation before, based on study by Ministry of Public Health. Even though the respondents was health workers, but we can see in our community right now there is a low number of confirmed cases or number of deaths by COVID-19. Then what and how the strategy to increase the scope of vaccination? As we know, our government have so many policies, to encouraging this acceleration of vaccination, we've known as vaccination program and vaccinasi gotong royong. With those policy, hopefully the number of target will soon be achieved. And also another policy that is vaccine certificate as travel requirements. Hopefully, it will help accelerate the scope of vaccination.
Okay, thank you, Mrs. Enda. But it seems that we still have a lot of questions actually. So let's just present another one, yeah. So another question from Della. Do people affected by COVID-19 only isolate, keep their distance, only wear masks? There are many cases of people who have been exposed to COVID-19. They recover and have been declared cured, but on another day, the person is exposed to COVID-19 again. Then what is the proper handling for people who are exposed to COVID-19?
Okay, we've known that COVID-19 was spreading easily by droplet, right? So what to do is by quarantine them, by isolating them from distancing them from their family, from their friends, so it will stop the spreading. So it is the proper action by isolating them. Actually, like that, Miss Ati. Then after we isolate them, we also give from treatment physically to reduce their symptoms, and then also we have to give them psychologically support, so like that.
So not only the medical support, but also the psychological support is needed for them. Thank you, Mrs. Enda. So thank you for the discussion. Now I would like to invite the Dean to present the certificate to the speaker, Mrs. Triana Mulyati, MSE. The time is yours.
Okay, thank you. On behalf of Faculty of Technology and Health Management IIK Octaviata Kediri, we present this certificate for you, Ms. Enda. It's a great honor to have you here, and we gain valuable insight of your interesting topic. Thank you.
Thank you, Ms. Anna.
Okay, thank you very much, Mrs. Anna. So, last but not least, we already have our third speaker here. He is Professor Mikhail Bogdandrafov from RUDN University, People's Friendship University of Russia, Institute of Medicine. Currently, he is a head of PA Frolov Department of General Pathology and Pathological Physiology. You can reach him through his emails. Let's wait for the CV. Okay. His area of expertise are on pathophysiology, chronobiology, chronomedicine, program-regulated cell death. He wrote more than 200 scientific papers, including 5 monographs, 63 papers indexed in Scopus, 64 papers indexed in WOS, and under Mr. Bogdandrafov's supervision, 7 PhD thesis research works have been identified. Without further ado, please welcome Professor Mikhail Bogdandrafov to present his presentation on public health nutrition, eating habits, and food security. Professor, the time is yours.
Good morning. Good morning. Dear ladies and gentlemen, I'm very happy to welcome you. And just a moment, I'm going to share my presentation. So welcome you, and I'm very happy to join you at the second International Conference, Public Health Intervention in Suppressing Health Problems During the COVID-19 Pandemic. I would like to say many thanks to the organizing committee for the opportunity to speak at such a respected event. All people are more or less influenced by eating habits. However, these habits should be divided into two groups, good and bad. Good habits include balanced and regular meals. Good nutrition means the presence of a sufficient amount of proteins, lipids, and carbohydrates, as well as micronutrients in the diet. A balanced nutrition means a diet that fully satisfies plastic and energy requirements of the body and its needs for vitamins and microelements.
Excuse me, sir. Perhaps you can slideshow the presentation so that we can see the presentation clearly, please. Slideshow.
What should I do?
On the right, but on the right below, down there, we have a slideshow button. Oh, perhaps you can just press F5 on your keyboard to make it bigger, the presentation.
Okay.
Perhaps in the bottom, sir. The slideshow button is on the bottom of your slide.
Can you see my presentation?
Yeah, we can, but it's small, so we need it to be bigger. By doing slideshow, perhaps it helps. Yeah, that button, sir. We circle the button. Can you please click that button for us on the below? We draw the arrow there. Okay. Next to the minimize one, sir. Down below. You need to come down again. We draw a red arrow for you. Down there. Okay, so yeah, you can continue your presentation, sir. So sorry for the interruption.
Is it okay now?
Yeah, it's okay. It's fine.
Okay. So I'll repeat the previous one. All people are more or less influenced by eating habits. However, these habits should be divided into two groups, good and bad. Good habits include balanced and regular meals. Good nutrition means the presence of a sufficient amount of proteins, lipids, and carbohydrates, as well as micronutrients in the diet. A balanced nutrition means a diet that fully satisfies plastic and energy requirements of the body and its needs for vitamins and other microelements. In case of a balanced nutrition, the diet contains about 54% of carbohydrates, 32% of lipids, and 14% of proteins. At the same time, the ratio between vegetable and animal fat should be 3:1. Another aspect of this problem, which equally important, is the regularity of eating. Any person should have at least 4 meals a day, and each meal should occur at approximately the same of day. This is very important because along with the sleep-wake cycle, the food intake is one of the main circadian or about 24-hour biological rhythms of the body. We get up to 170 chemical compounds with food. A normal diet should include a sufficient amount of the so-called micronutrients, including flavonoids, microflavors, indoles, 12 vitamins, and 20 trace elements. A person should consume about 600 grams of vegetables and fruit per day, but commonly an adult consumes only 300 grams in the average. Energy consumption of modern people is 2,200 kilocalories for men per day and 1,800 kilocalories a day for women. At the same time, to obtain the necessary amount of micronutrients, one has to consume an amount of food which is equivalent to 3,000 kilocalories per day. But in this case, the excess of calories will be realized as obesity. Bad habits are as follows: absence of breakfast, frequent snacks, eating fast food and convenience food, excessive consumption of sugary food, excessive salt. All these habits lead to unhealthy eating behavior, which means permanent overeating, which ultimately results in the development of overweight and obesity. And we call it elementary or nutritional obesity. Many factors contribute to the development of nutritional obesity, and let us consider the most important ones. Hereditary factors. Genetic studies show that if the children of two parents with normal body weight have only a 10% probability of obesity, then the possibility of overweight in the children of one or both obese parents is 50%, or sometimes 50 and 80% respectively. However, there is an evidence that foster children of obese parents have a higher incidence of obesity than foster children of parents with normal body weight. This indicates that along with genetic factors, nutritional conditions in the family play an important role in the development of obesity. At the same time, in animals, some genetic defects that contribute to obesity were also found. These factors lead to a decrease in the excitability of hypothalamic center of satiety. As a result, a feeling of fullness occurs when eating much more food than is required for normal animals. In addition, both increased proliferation of adipocytes and defects in numerous lipolysis enzymes can also be genetically determined. Central neurogenic regulation, central neurogenic mechanisms. The centers of lipid metabolism and food consumption are localized in different parts in the central nervous system, but the main regulation of these processes is carried out in the hypothalamus. A decrease or increase in the content of serotonin or tryptophan in this area may be accompanied by changes in eating behavior and body weight. In addition, the hypothalamus regulates the release of insulin and glucagon, which are related to both lipogenesis and lipolysis. So, the restructuring of vegetative centers can contribute to the development of obesity. Next, disorders of endocrine regulation. Hyperinsulinism, hyperfunction of the adrenal cortex, hypothyroidism, decreased production of growth hormone, hyperfunction of gonads, hyperproduction of adrenocorticotropin. All these factors themselves can play an important role in the development of obesity. However, even if the secretion of these hormones is normal, but is at the upper or lower limit of the normal range, in case of overeating, such conditions can play a role of factors that will contribute to obesity. Metabolic features of the body. The following metabolic features can lead to obesity. Redistribution of energy contained in nutrients to lipid synthesis. An increase in the effectiveness of energy extracted from nutrients and storing excess calories in the form of fat. An increase in the effectiveness of physical activity, which can reduce the body's actual needs for calories, and the excess of calories will accumulate in the body in the form of fat. For example, if some kind of activity requires 5,000 kilocalories per day, sometime later, calorie intake of food must be reduced under the same amount of work, since the previous effect will be achieved with lower energy costs. And also, we have to mention inhibition of lipolysis, that is, suppression of mobilization of triglycerides from adipose tissue. Next important factor, hyperplasia of adipose tissue. It was found that if an increase in the number of fat cells, adipocytes, occurs in the body, then it persists for the remaining life. Especially intensively, adipose tissue can undergo hyperplasia in the fetus in the last third of intrauterine development during embryogenesis, also in early childhood and also during puberty. Overfeeding during these periods, leading to an increase in the number of adipocytes, creates the basis for the development of obesity in the future. And also, we have to mention psychological, social, and economic factors. Psychological factors may play a certain role in the development of obesity. Often, in case of emotional disturbances, food intake can serve not only to satisfy the feeling of hunger, but it can also suppress excitement or depression, anxiety maybe. People with excessive body mass may be more receptive to food-related stimuli and signals, time of day, type of food, social environment, and so on, than people with normal body weight. Moreover, these factors begin to play a more important role for a certain period in stimulating appetite than purely physiological factors. It was proved that the number of obese people increases as the material well-being of society is becoming better. At the same time, the prevalence of this pathology is influenced by a number of other social and even ethnic factors. For example, frequency of obesity is intensively correlated with educational level. The aesthetic ideas of specific ethnic groups about the ideal body shape also play an important role in the prevalence of obesity. And maybe one of the most important factors is hypodynamia. A little more than 100 years ago, the share of physical laboring and socially useful human activity was up to 95%, and now, at present, it is just 1%. Modern community suffers from physical inactivity, and therefore the share of energy consumed for physical labor decreases, and its share required for lipogenesis increases. In addition, obesity increases physical inactivity, which in turn leads to the progression of obesity. So, a vicious cycle is closed. Physical inactivity contributes to the development of obesity, and obesity decreases physical inactivity. Next problem is food security. The pandemic of COVID-19 in 2020 and 2021 has affected all areas of public life, including food security in the world and in some individual countries. However, the concern of the global community over food security is not only driven by the pandemic. The number of hungry people and undernourished people increased from 784 million in 2015 to 821 million in 2018. And this alarming trend has not been reversed until now. The current state of food supply causes serious concern. According to Food and Agriculture Organization of the United Nations, FAO experts, the number of people suffering from hunger will only grow in the future. Food security is understood as ability of humanity and individual states to meet the needs of population in food products in the required volumes, range and quality, providing resources to create appropriate economic conditions. There are 4 dimensions of food security, such as food availability, excess of food, use of food, and stability. A decrease in the population's income in the context of the pandemic has led to a change in the structure of food consumption towards simplification of consumer preferences. Lockdowns, closure of restaurants and cafes, restrictions of freedom of movement, fears of shopping in traditional chains resulted in a redistribution of consumption and an increase in food purchases in a contactless mode. The decline of people's income led to a significant restriction of consumption, and as a result to an aggravation of malnutrition and even hunger. This is especially typical for countries dependent on food imports. According to FAO, Food and Agriculture Organization of the United Nations, such countries will see annual rates of undernourishment rise by 8% during the pandemic of coronavirus. In general, the situation with food security in the world can be described as alarming, and in some countries, even as critical. Therefore, it is so important to strengthen the interaction of countries in solving this global problem. So, in the world, food imbalance is aggravating. Almost every 10th inhabitant of the planet suffers from malnutrition and hunger, and every 4th one from diseases based on excessive body weight and obesity, such as atherosclerosis, coronary heart disease, hypertension, diabetes mellitus, and others. This is of particular importance during the pandemic of coronavirus, since elderly patients with diabetes, cardiovascular diseases, and excessive body weight are at a higher risk. On the other hand, nutritional deficiency is one of the main causes of immunodeficiencies, which also seriously affect susceptibility to infectious diseases and the ability of the body to resist them. This is a very serious challenge, and the future of the humanity will depend very much on the response to it. The pandemic of COVID-19 will end sooner or later. However, new epidemics will appear and other infectious diseases, including AIDS and hepatitis, viral hepatitis, have not gone. And a lot depends on how resistant we are to them. And this is largely determined by proper nutrition. Thank you very much for your attention.
Okay, thank you very much for the insightful presentation, Professor Mikhail Bogandravo. We already have a lot of questions over here, but I will just present 3 questions. Now let's come to the question and answer session. The first question, we'll present it on the slide. Please read. First question. Okay, here is the first question from Sylvie. COVID-19 pandemic can cause food insecurity and malnutrition, obesity, or undernourishment. Can you explain to us what strategy used there in Russia to prevent food insecurity and malnutrition there?
Mm-hmm. Thank you. Thank you very much for this question. In the Russian Federation, the situation is different depending on the period of pandemic, but it is still alarming. And as concerns food security, the government is trying to do its best to support people and to provide them with proper treatment and proper vaccination in this situation. As concerns food security, it is not a very difficult problem at this moment, and because the main problem was in distant orders and contactless purchases, and now it is this problem is solved, and more people can go shopping and get food, and there is no problem with food excess.
Okay, thank you. So there's no problem on the food access there, but it's more on the physical distance, sir. So now move on to the second question. The second question, please. This one. How to meet the basic needs, the willingness when pandemic, in case there is limited food there, how to meet the needs?
Yes, how to meet basic needs, as if I correctly understand the question. The problem is that in case of the pandemic, we mostly have to think of health and how to treat patients, how to prevent the spread of infection. But anyway, we are trying to continue living, and one of the most important problems is food access and food security. So we have to strengthen the policy to provide people with food and secure food. I have mentioned in the presentation it's not only the problem of access, but maybe more important to support and to provide proper nourishment, and food must be balanced, and we have to think of it maybe even more in this situation, because very often the problem is that there are not the patient is at a higher risk when they are undernourished, because it influences the state condition of the immunity. And we have to think of the immunity, and we have to support it. So in these terms, proper nourishment is an important factor.
Okay, thank you. So too much can be bad also. Now move on to the last question. The last question from Haris. Why obesity is a trigger for diabetes mellitus, and how to control it?
Yes, obesity is a trigger for type 2 diabetes mellitus, which is insulin independent. Elderly people who often suffer from type 2 diabetes mellitus have been obese, and this is due to the following mechanism. There are very many insulin receptors in the adipose tissue, and but if we compare the number of insulin receptors in one hepatocyte and in one adipocyte, there are much more insulin receptors in one hepatocyte, up to 25,000 molecules of insulin receptor in one hepatocyte, whereas just 5,000 insulin receptors in one adipocyte. But the total number of insulin receptors in the whole adipose tissue, in the whole body, is much more. So when a patient has excessive body weight or obesity, he requires much more insulin to support his metabolism. And with time, due to hyperfunctioning of beta cells of the pancreatic beta cells, they begin to lose their function and produce less insulin. This is the mechanism. How to prevent it? I think it is better to control body weight, to think of it, and to think of the diet. All people can do it, but sometimes it is rather difficult. Many people want to lose weight, but when they have done it, they begin to gain weight again. And it is especially difficult to control normal body weight, but it is the best way. And also physical exercises and proper diet.
Okay, thank you very much for the clear explanation, and thank you very much for the discussion. Now, I would like to invite the Director of Resources of Institute Ilmu Kesehatan Bhaktiviata to present the certificate to the speaker. Dr. Ekawati Sutikno, MMMKes, time is yours.
Thank you. On behalf of Faculty of Technology and Health Management IIK Bhaktiviata Kediri, we present this e-certificate to you. Prof. Mikhail from RUDN University, Russia.
Thank you very much. Thank you very much.
It's a great honor to have you here and we gain valuable insight of your interesting topic. Thank you, Prof.
Thank you very much.
Thank you, Ibu Eka and Prof. Mikhail. Finally, we come to the last session of this conference. Thank you to all presenters and also thank you to all audiences for your participations. Hopefully, the information that we have shared today would be useful for all of us. Thank you for your attention. Now, I will give the microphone back to the MC. Please, Ibu Yeni.
Thank you very much, Ms. Ati. Thank you, Professor Rusli, Bu Endah, and Professor Mikhail, our respected speakers, for addressing interesting topics today. What an interesting and fruitful session we have. We hope that all participants could gain much benefit from the topics presented during these sessions. Thank you very much. And now we will hold a further session. Please, may we request our guest of honor and all participants to activate the camera. Please turn on your camera. And our team will manage and start taking your pictures in turn. Please activate your camera. Prof. Rusli, Pak Ana, may we request you to activate the camera? Okay, thank you. And our team will manage, start taking your picture. First screen. The second one. Okay, thank you very much. Excellencies, participants, ladies and gentlemen, we have had a productive time together for the last 4 hours, and this event is about to come to the very end. May we request all participants to fill in the attendance list via the link provided by the committee, and we provide a certificate who successfully fill in that form. Please kindly make sure to write down your email correctly so you can simply receive the certificate. Excellencies, participants, ladies and gentlemen, we now come to the end of this conference. On behalf of the host and the committee, we would like to extend our deepest appreciation to you all. Thank you very much for your attention and participation. We wish to see you again on another occasion. Stay safe, stay healthy, and have a nice day. Wassalamualaikum warahmatullahi wabarakatuh.
Menuju sukses ditentukan oleh langkahmu hari ini dengan terus memilih yang terbaik. Berdiri sejak 1900. Melangkah menuju masa depan suksesmu bersama IIK Bhaktiviata. Pendidikan berkualitas, tentukan masa depan cemerlang. Dibimbing dosen berkompeten. Mahasiswa dicetak terampil, andal, dan profesional. Penerapan kurikulum KKNI dengan 60% praktek dan 40% teori. Mengasah keterampilan mahasiswa untuk bersaing dalam dunia kerja. Dilengkapi 63 laboratorium sebagai sarana memaksimalkan pembelajaran. Katalog online perpustakaan untuk mempermudah pencarian literatur. Atmosfer akademik yang baik, mendukung proses belajar mahasiswa. Pendidikan didukung oleh sistem komputerisasi. Berpengalaman lebih dari 30 tahun. Mencetak tenaga kesehatan profesional. Telah luluskan lebih dari 14.000 alumni sebagai tenaga kesehatan profesional. Dibimbing oleh dosen berprestasi hingga taraf internasional. Asah potensi mahasiswa untuk menjadi unggul dan terbaik. Fasilitas sarana olahraga untuk kegiatan mahasiswa. metode pembelajaran audiovisual di auditorium.